The Hidden Risks of Root Canals, Exploring Safer Alternatives for Long-Term Oral Health. Introduction. Root canals have long been a standard dental procedure for saving infected teeth. However, growing evidence suggests that this seemingly routine treatment may have far-reaching consequences for overall health. The documentary Root Cause has brought widespread attention to the potential dangers of root canals, raising concerns about the long-term health effects that can result from leaving dead tissue within the body. While root canals are intended to remove infection and preserve the tooth, emerging research highlights the challenges of fully sterilizing root canal-treated teeth and the potential for systemic health issues stemming from residual bacteria. In this article, we explore the potential risks of root canals, the connection between oral infections and chronic disease, and safer alternatives that may support long-term oral and systemic health. Understanding the root canal procedure and its challenges. A root canal involves removing the infected pulp of a tooth, cleaning the inner chamber, and sealing the space to prevent further infection. Although the procedure successfully alleviates pain and preserves the tooth structure, critics argue that it may leave behind harmful bacteria that thrive in the microscopic tubules of the dentin. Why root canals may pose risks. Incomplete sterilization. Despite thorough cleaning, root canal-treated teeth contain millions of tiny tubules that are impossible to sterilize completely. These tubules can harbor bacteria that produce harmful toxins, which may escape into surrounding tissues. Formation of toxins. Anaerobic bacteria that survive in these tubules release endotoxins and exotoxins, which can trigger chronic inflammation and immune responses. These toxins may eventually enter the bloodstream, contributing to systemic inflammation and chronic health conditions. Potential for silent infections. Root canal-treated teeth may appear normal on dental x-rays, even when a low-grade asymptomatic infection is present. These silent infections can continue to release harmful bacteria and toxins into the body over time. The link between root canals and chronic disease. A growing body of research suggests a correlation between root canals and chronic diseases, including cardiovascular disease, cancer, and autoimmune disorders. While causation has yet to be definitively established, the evidence raises important questions about the role of oral infections in systemic health. 1. Cardiovascular disease. Research indicates that chronic oral infections may contribute to heart disease by triggering systemic inflammation and promoting the buildup of arterial plaque. A study published in the Journal of the American Dental Association found that individuals with a history of root canals were more likely to develop cardiovascular conditions, highlighting the potential impact of oral infections on heart health. 2. Cancer and immune dysregulation. Studies exploring the connection between oral health and cancer suggest that chronic inflammation caused by persistent infections may create an environment conducive to cancer development. Infections originating from root canals may contribute to immune system dysregulation, compromising the body's ability to detect and eliminate abnormal cells. 3. Autoimmune disorders and chronic fatigue. Low-grade chronic infections can place a continuous burden on the immune system, potentially leading to autoimmune responses and chronic fatigue. Research suggests that unresolved infections from root canals may exacerbate autoimmune conditions such as rheumatoid arthritis, lupus, and multiple sclerosis. Safer alternatives to root canals, a biological approach. For individuals concerned about the potential risks associated with root canals, there are safer alternatives that prioritize long-term oral and systemic health. Biological dentistry, a field that emphasizes the connection between oral health and overall wellness, offers holistic approaches to managing dental infections while minimizing harm to the body. 1. Tooth extraction and proper healing protocols. In cases where a tooth is severely infected or cannot be salvaged through less invasive means, extraction may be the safest option. Biological dentists often recommend careful extraction techniques that remove the periodontal ligament and surrounding infected tissue to prevent bacterial persistence. Post-extraction protocols: proper irrigation with ozonated water or hydrogen peroxide to sterilize the extraction site. Application of platelet-rich fibrin, PRF, to accelerate healing and tissue regeneration. Use of biocompatible materials to prevent future infections. 2. Zirconia implants, a biocompatible solution. For patients seeking tooth replacement after extraction, zirconia implants offer a metal-free, biocompatible alternative to traditional titanium implants. Zirconia implants are non-corrosive, less likely to promote bacterial growth, and do not interfere with the body's electromagnetic field. Advantages of zirconia implants: lower risk of inflammation and infection, better compatibility with the immune system, reduced likelihood of corrosion or galvanic reactions. 3. Ceramic bridges and partial dentures. In cases where implants are not suitable, ceramic bridges and partial dentures can provide functional and aesthetic solutions while maintaining biocompatibility. These options restore chewing ability and prevent shifting of surrounding teeth. Prevention: supporting oral health to reduce the need for root canals. Preventing dental infections in the first place is the most effective strategy for avoiding the need for invasive procedures like root canals. Prioritizing oral hygiene, maintaining a nutrient-rich diet, and adopting natural antimicrobial practices can help protect against tooth decay and infection. First, optimize nutrition for stronger teeth and gums. A diet rich in vitamins A, D, and K2, along with minerals such as calcium and magnesium, supports healthy teeth and gums. These nutrients strengthen enamel, reduce inflammation, and enhance the body's natural defense against infections. Key nutrient sources: leafy greens, fatty fish, pastured eggs, and organ meats. Fermented foods that support a balanced oral and gut microbiome. Second, use natural antimicrobial agents. Hydrogen peroxide rinses, ozonated water, and xylitol-based oral products can help reduce harmful bacteria in the mouth and prevent infections. Oil pulling with coconut oil may also promote oral health by reducing plaque and harmful microorganisms. Third, maintain excellent oral hygiene practices. Brushing and flossing twice daily, along with regular dental cleanings, can prevent bacterial overgrowth and reduce the risk of cavities and gum disease. Using a water flosser may enhance plaque removal and promote healthier gums. Conclusion: root canals remain a widely performed dental procedure, but growing evidence suggests they may pose hidden risks that extend beyond the mouth. The potential for incomplete sterilization, persistent infections, and the resulting systemic inflammation highlights the need for alternative approaches that prioritize overall health. Biological dentistry offers safer solutions, including tooth extraction, zirconia implants, and enhanced post-extraction protocols that minimize harm and promote optimal healing. By supporting oral health through proper nutrition, natural antimicrobial practices, and vigilant hygiene, individuals can reduce the risk of dental infections and minimize the need for invasive procedures. As awareness grows, embracing these holistic strategies may offer a path to long-term oral and systemic wellness.